Hey, welcome to our video series, Women's Health Matters. My name is Dr. Obi Osuchukwu. I will be continuing our conversation on hormonal contraceptives with particular interest in this video on their impact, hormonal contraceptive impact on mental health. Generally, the narrative around hormonal contraceptive is about period management, pregnancy prevention, things that had to do with reproductive organs, which is the primary need for that. But often there are issues that could affect other parts of the body, especially the brain and the adrenals. Hormone contraceptives contain two major chemicals, progestogen or estrogen. Some have just progestogen, others will have both of them, estrogen and progestogen. The ones that have both are called combined pills. These chemicals have been used, they're synthetic, so they're outside of the body, they're produced outside of the body, and they are being put into the body. They have effect in the reproductive organs, but it has also been shown to have effect on places like the brain and the adrenal. When it comes to the brain, there are two major neurotransmitters or brain chemicals that can be affected. The first one is serotonin. Serotonin is the chemical that helps us to feel calm and feel happy. So when you say, I am okay, you're saying my serotonin is doing okay. But when the serotonin is low, you start having feelings of, you don't know why you're crying. You feel like crying. You don't have interest in doing anything. Your mood is so low. You withdraw from socials. You don't want to be involved with anything. So depression is gradually creeping in. It's been shown that people who are on contraceptives, especially young people between the ages of 15 and 25, they are 2 times more likely to develop depression than their counterparts who are not on contraceptives. There are so many reasons why they are on contraceptives, but what that means is if young person is on contraceptives, it becomes so important that their mental health is managed because it's not just depression that they might be suffering from. Some of them might have extremes of even suicidal ideation or sometimes suicide attempt. So it becomes important that these young people are constantly monitored. Every woman should be monitored. Their mental health should be monitored if they are on contraceptives. The second chemical neurotransmitter is dopamine. Dopamine is the chemical that helps us to manage our executive function, the front of our brain. Things like manage self-control, being able to manage your time, being able to, feel motivated, have the drive to do, the desire to do things, focus, ability to learn. Now, all these things are different executive functions, meaning that when the dopamine is low, people start exhibiting ADHD-like symptoms. I said like means they possibly don't have ADHD, but the symptoms they're exhibiting mimic that of ADHD because dopamine is the principal chemical that is implicated in ADHD. Now, young people who have ADHD and are on contraceptives, it has been shown that their symptoms exaggerate 5 to 6%. That's increase in the symptom severity of the symptoms they're having already for those who have ADHD, but those who don't have ADHD can also exhibit ADHD-like symptoms. So for young person, for example, They don't have desire to study. They don't want to, they have brain fog. Attention span is so limited. Their ability to focus in anything, they will rather swipe on their phone all day. And all those symptoms, so some of them will go for assessment for ADHD and they are told they haven't got ADHD. That's because they haven't got ADHD, they have ADHD-like symptom due to their dopamine being affected by the contraceptives they're on. Again, part of the reasons why, if a young person, especially all women, but young people, if they're on contraceptive, they have to be monitored. Their mental health needs to be monitored as well. Now, the third thing that can be affected by when people are on the hormonal contraceptive is their adrenal, their ability to manage stress, cortisol level. So such people, they find it so easily irritable, easily overwhelmed, unable to manage stress, things they used to be able to cope with, they're struggling to cope with them. If that is the case, again, it could be linked to the contraceptives they're on. The fourth thing that has been shown as well in relation to this is that for people who are on contraceptive, hormonal contraceptive for a while, a long while, it's been shown that there is brain structure changes. For example, their gray matter volume has been shown to be reduced or shrunken a little bit. And the gray matter is responsible or is part of its function is helping us to regulate our emotions, meaning these people, their inability to manage, self-control, deal with issues. So you can imagine then people who have ADHD already and their ability, the part of the brain that helps to regulate emotion is not there or is being affected, it will exaggerate their ADHD. So when you look at these four major things, number one is the serotonin. Number two is the dopamine. The third one is the cortisol. The fourth one is the emotional dysregulation. All these things are mental health challenges. So if you're having any of the challenges, you're feeling depressed or having anxiety since you started this contraceptive, or you find yourself developing, you can't study, your focus, or you're having brain fogs, or you just notice a change in your mental well-being, please contact your healthcare provider and have conversations so that they'll be able to review your case. In some situation, if it's mild to moderate, they might be able to just monitor you but still leave you on it because some people, it settles over time, but some others, if it doesn't settle or the symptom is moderate to severe or severe indeed, then it might be that your healthcare professional might decide to review your medication, or they might decide as well to engage in multidisciplinary services where they will still be managing you, but they will solicit the assistance of the mental health care professionals so that you are taken care of on both sides. You don't have to manage it all by yourself, especially for young people. They hide, they don't talk to anyone, they're struggling by themselves. You only get to know that something is going wrong through their academic performance. They have poor academic performance, poor attendance, friendship issues. They start withdrawing, and then suicide ideation. We don't need to suffer in silence. Whether it's a young girl or women, we don't need to suffer in silence. If you are on any of these contraceptives and you're having any of these symptoms, please speak up, talk to someone, talk to your healthcare professional. It could be a nurse, it could be your psychologist, it could be your GP surgery, your GP, Any of your healthcare professionals, start somewhere. Speak to them so that they can help you out and help you to stay calm and get the benefit of the contraceptives you're on. And if you need to come off it because it's too severe, then they will also advise you accordingly. Take care of yourself, and I will see you in my next video. Bye. Bye.